Hello, everybody. Good morning, good afternoon, wherever you might be. My name is Josh with Gusto. If we could do, we've got just a few minutes before the top of the hour. If we could do a quick systems check, if you wouldn't mind in the chat box, if a few people would let me know if you can see our screen, it's the title slide, and if you can hear me loud and clear, that would be very helpful. Thank you. Wow, thank you. I usually call out a few names and say thank you, but the chat box is on fire. So it looks like it's overwhelmingly good. Thanks, Damon. Appreciate that. Elizabeth, Amy, Robert, Carrie, thank you very much. It looks like we are up and going and things are looking good. We have a packed hour today. We're going to get started here in just a couple minutes, promptly at the top of the hour. And we will get going. So I'll be back in just a minute or so. Okay, good morning, good afternoon, everybody. This is Josh. We are waiting just another minute or two as folks file in. Reshma, yes, everybody is muted on this. This is a broadcast. We're expecting very, very high attendance on this. So that's just the standard settings for this type of event. But we welcome chat and the question box to communicate. I already see a few questions coming in. Thanks, Kyle. Okay, we're going to give it about a minute and a half more as more people come in, and we will get started at the top of the hour. Again, we have a packed hour of information for you, and we will be getting to it promptly here in just about 1 minute. Okay, good morning, good afternoon, everybody. This is Josh with Gusto. We're going to go ahead and get started. Inevitably, we have a big burst of folks joining us right here at the top of the hour. So I'll just cover some housekeeping to get us started. And then here within a few minutes, we will be into the content. The title of today's webinar is COVID-19 HR Guidance and Best Practices. We certainly appreciate you stopping by and spending a part of your day with us. We have a great expert today that's going to cover the topic extensively. I know she has been researching this night and day for the past few weeks, and we've got a fantastic presentation to try to deliver much needed guidance during these times. If we could go ahead and advance the slide. Just a few housekeeping items. We will send the recording and the slides after the webinar. We do welcome your questions. However, disclaimer here, we are expecting extremely high attendance here. We are going to do our best. I know Kara is fantastic at trying to pick off questions and address them as they come. We are expecting hundreds of questions. Again, we'll do our best, but we may only be able to get to a few of them. And then one other point, we do have a final poll at the end of today's webinar. We know everybody multitasks during these webinars. I do it, not a problem, but we would encourage you and really appreciate it if during that poll you hop back over and participate in that poll. Okay, moving to the next slide. At this point, I'm going to turn it over to our expert, Kara Govro. She's an attorney compliance expert, and like I said, she has been researching this topic endless hours over the past couple of weeks, and she has a lot of great information and content ready for you. So I will turn it over to you, Kara. Take it away.
All right, thank you. Hi, everyone. Good morning or good afternoon, depending on where you are right now. We have a lot to talk about today, pretty much a full hour of content. You're looking at the agenda right now. We know there's a lot going on. My coworker Laura said the other day that trying to keep up with COVID right now is like trying to nail Jell-O to the wall, which feels about right. Employers are having pay issues, safety issues, morale issues, leave issues, and will my business survive all of these issues? And unfortunately, almost none of this has an easy answer. Business owners, executives, HR departments are really going to have to put their heads together and decide what's best for each of their businesses individually. We won't necessarily be able to guide you in some of these really complicated areas. That said, we certainly can help you understand some of them and some of the issues at play. So we're going to do our best today to share information that we think is most relevant. All right, so let's talk first about the current guidance from the CDC. This hasn't changed significantly. Some of this is going to be a little bit redundant, but a few things have been added in the last, I'd say, week or so. So our guidance right now for keeping the workplace safe, and I should say the CDC's guidance, is to stop handshaking, have employees wash their hands when they come in, and schedule regular hand washing reminders via email or intercom or whatever messaging system works best for your organization. So maybe have people wash their hands once an hour. Even if they're just sitting at their desk, you know, this is a pretty stressful time, and getting up from one's desk is sort of always a good idea. So even if it's just to get their legs stretched a little bit, that can't hurt. We'd also recommend hanging posters from the CDC. If you haven't already, you probably have. They've got some really nice, colorful, eye-grabbing posters. I personally posted them in the bathrooms at work probably 3 weeks ago. So those are good. Disinfect surfaces like doorknobs, tables, desks, handrails. I'm going to add to that microwave door handles, fridge door handles, and the button on your water cooler. If you've got a water cooler, that button on there might be the most touched surface in the entire office. So disinfect that stuff regularly. And don't just encourage employees to do it, but actually make that somebody's job. And if you don't have anybody who's going to appreciate being given that job, you can assign it to yourself. But I do think it's really important right now. And a new piece of advice has been to increase ventilation by opening windows or adjusting air conditioning. I know most offices, for instance, probably don't even have windows that you can open, but you can probably turn the fan on or crank the AC up or down. If you even just mess with the AC regularly, that might get it to kick on and off and circulate your air more frequently. At this point, we really want to be traveling, don't want to be traveling, so cancel travel plans. Adjust or postpone large meetings. And, you know, large is probably anything over 10 at this point. Use video conferencing if it's available to you. If you can't use video conferencing, which honestly, I think you can probably get free from various sources on the internet right now. But if you can't figure that out, just have people FaceTime or, you know, group conference call, whatever you can come up with to avoid close contact. If you really, really need an in-person meeting, hold it in a larger, open, well-ventilated space, and encourage everyone to have about 6 feet of separation between one another. And then a final suggestion here would be to eliminate shared food. So if you've got snacks in the kitchen, like, bags of chips, containers full of gummy bears, nuts in a jar, even if you've got scoops, or, you encourage people to use scoops for those things, I would get rid of them at this point. Not everyone can be trusted. Not everyone can be trusted on, any given day. And there are still people in this situation who don't think this is a big deal yet. And to some degree, I understand that if you're like maybe sort of in the middle of the country where there really haven't been any outbreaks or any deaths, it doesn't seem serious. Maybe that's not a crazy way to feel. Certainly on the coasts, we're all feeling it pretty hard right now. So some of this seems incredibly obvious, but in other places it might not be. So get rid of that shared food for now. These are some recommendations that could be good for probably some workplaces, but definitely any workplace where you've got the public coming in. So if you're a restaurant that's still allowed to be open, a coffee shop, any kind of public space. So if you've got booking and scheduling, if you've got customers who come in for appointments, basically stagger your schedule so you don't have more customers in there at a time than absolutely necessary. I went and got my nails done last week, and they were only allowing like 2 staff people and 2 employees in this fairly large space at any given time. And that actually seemed really prudent. Use online transactions where possible. Maybe one of the silver linings in all of this is that we're going to learn to do some things that we weren't particularly good at before. If your business sells something that can be done online or can be sold online, this might be the time to figure that out. Business is slow. Maybe we've got some extra time on our hands. We can figure out how to, build a website and set up e-commerce. So whatever you can transfer to online, go ahead and do that. I know a lot of us can't put anything online, but if you can, that's an idea. If you're open to the public, you can also remove tables and chairs to reduce capacity and create distance. You can also encourage tap and pay. So Apple Pay, Google Pay, Android Pay. I don't know what the other systems are called. I have Apple Pay. I used that before this happened. I'm guessing a lot of people are learning to use it right now. It's a great idea. It means you don't have to touch a pin pad. You can keep your hand most of the time on your own phone. So encourage customers to use that if possible. And then provide disinfecting wipes or hand sanitizer at the door or at the cash register, someplace where people can use it. And disinfect things that are touched a lot. Like if you've got a stylus on your, checkout machine, next to the pin pad so people can use the credit card transaction, disinfect that a lot. If you can, between every customer. I know that's kind of crazy though. So just do as much as you can, as best you can. And I know hand sanitizer and disinfecting wipes are hard to come by right now. But again, do what you can. And then another safety question we've gotten a lot is, can we take temperatures or ask employees about their health when they come in each morning? And at this point, the EEOC, the Equal Employment Opportunity Commission, they enforced the ADA. Prior to the pandemic, they would have said, no, you cannot take an employee's temperature when they come in the door at work. Get out of town. That's a medical examination and you're not allowed to do that. But they have recognized the current situation, and because of the CDC's guidance, we've all sort of agreed there's community spread. It's important that we don't encourage community spread. So if you want to take employees' temperatures when they come in for their shift, you can do that. You can also ask questions. But if you want to ask questions, make sure they're specific to COVID-19. So, do you have symptoms such as shortness of breath, fever, coughing, etc.? And you might even want to preface that by saying, we're looking for symptoms of COVID-19. What we don't want to do is ask open-ended questions like, how are you feeling today? Do you have any pains? Where are your body pains? How is your mental health? These can still get us into disability inquiry territory, that's just not warranted by this. So this is not an opportunity to figure out what's wrong with all your employees and dig into their medical histories. What you can do, though, is sort of assure that they're safe enough to be in the office for the day. That said, big caveat on that, just because someone doesn't have a fever doesn't mean they don't have COVID-19. They've determined that the average incubation period is 5 days. We're using 14 to be safe. After 14 days, 99% of people are going to be clear and aren't going to have the virus. The average is 5 days. So you could have somebody coming into work for 5 days on average, looking perfectly fine, even though they're a carrier and could potentially be transmitting the virus. So don't let your guard down with any of your other safety precautions just because you've taken temperatures at the door and people tell you they're feeling fine. That does not mean everyone is fine. It doesn't mean everyone is healthy. It just means they're slightly less likely to spread it because they're not actually coughing on people. All right, we have answered literally thousands of questions, probably 10,000 questions easily at this point over the last couple of weeks. So I'm going to hit some highlights that we have received from employers. I think this is a no-brainer now. 3 weeks ago, we had employers asking, can I send a sick employee home? And yes, you can. In fact, you are able to send a sick employee home at any time, employer, so long as you believe them to be sick with something that is contagious. So pandemic or not, if you think somebody's got a cold, they're coughing around, they're sniffling around, you're afraid they're going to infect other people, you could send them home. If you thought they had a flu, you could send them home. We don't want to send people home because they have anxiety or because they have wrist pain, but certainly if you think somebody has something contagious, you are welcome to protect the rest of your workforce, and that is absolutely true under pandemic conditions as well. The follow-up question to that is often, when can they come back? So keep in mind that 14 days, that's an incubation period. That's when they might have it without showing symptoms. Once they have it and they get better, they can usually come back within like 24 to 48 hours after symptoms have totally resided. Leave that to their healthcare provider. Let their doctor decide when they should come back to work. Another follow-up question is, can we require a note for them to return after sick leave? And yes, you can, whether it's fitness for duty, whatever you want to call it. Generally, we wouldn't recommend those. They could get into ADA-ish territory under the circumstances. You could ask for a note. However, the CDC is really, really asking that you don't, and I suspect your public health authorities are making the same plea. The healthcare system cannot deal with any more people right now. That's why we're all staying home, right? This whole flattening the curve thing is about not completely maxing out our healthcare system such that doctors are having to decide who lives and who dies because we only have so many ventilators. So please, if somebody tells you they've recovered, don't send them back to the doctor. In fact, the doctor may refuse to see them under those circumstances if it seems they've recovered. It's very possible. This is another one of those silver linings. We're going to learn things we didn't do before, know how to do before, that their clinic or their doctor would be willing to send you a quick email saying this person has been cleared by me to return to work. Keep in mind that a lot of doctors right now, at least Kaiser, which is fairly widespread, at least on the West Coast, they're encouraging everyone to do appointments either online or by phone or video with their doctors. They're trying to keep as many people out of the clinics as possible. So be open to getting something other than a written doctor's note and possibly open to getting nothing at all. What about employees who are out sick and we don't know why? We've got a sick leave policy. They've called in and said, I need to take a sick day, and they haven't explained themselves. Usually we don't want to ask them to explain themselves. However, under the circumstances, we can ask about symptoms, but we once again need to keep it related to COVID-19. So I think we're acknowledging now that the list of symptoms may be longer than cough, shortness of breath, and fever. So you could go look up the CDC's latest list of symptoms and ask about those. But again, don't just be asking open-ended questions, not, what are you sick with? What do you think you have? What are all of your symptoms? What hurts? Keep it specific to COVID-19. We're allowed to ask these questions right now because there's a direct threat to the workplace. So we want to make sure we sort of stay within that allowance. Can we make an employee with a sick family member stay home? Yes, you can. Once again, this is another question where maybe 4 weeks ago we would have said something different, or the CDC, I should say, would have said something different. They would have sort of had a different risk assessment here. But at this point, if somebody's got a sick family member who seems to be sick with COVID-19 or something that could be COVID-19, we can certainly have that employee stay home. In fact, that employee will almost certainly be told to stay home by a healthcare professional. So there are 3 levels of risk when it comes to contact with a family member: low, medium, and high. Someone who has taken really extreme precautions may qualify as low risk, but most normal human beings acting like normal human beings will be in the medium to high risk category. And then when you look at the CDC's risk assessment, those people have been told to either isolate or quarantine, which are 2 different levels of the same thing, meaning stay home. So yeah, if you've got somebody with a sick family member, you should in fact not let them come into the office at this point. You don't, however, want to make an employee stay home because they have a relative that's sick with something else, like a relative undergoing chemo or a relative with diabetes. It's not your job to take care of a third party, and it could be disability discrimination to send somebody home without pay because they're associated with someone with a disability. There's actually disability association is covered by the law. So not your job to worry about their immunocompromised relative. That said, if somebody tells you, I want to work from home or I want to take a leave because I have an immunocompromised relative, you should absolutely honor that request. Don't force that employee to come in and, potentially kill their relative at the end of all of this. What about employees who don't want to come in? Can we make them come in? So again, that employee who's got somebody immunocompromised at home, I absolutely would not make them come in. That just feels morally risky and maybe down the road legally risky. I don't think the legal risk is great, but I would strongly not suggest that. However, if they don't have anybody at home to worry about, they're not immunocompromised themselves, the risk in your area, maybe you're somewhere in the middle of the country that doesn't have an outbreak at all. If the risk is very low, then yes, you could enforce your attendance policies and say you have to come in or you're in trouble. That would be acceptable. Again, though, if they require an accommodation, like they are immunocompromised, then no, we don't want to be forcing those people to come into work. It would be a very reasonable accommodation to let that person either work from home or take a leave. All right, there are bazillions of questions coming in, and most of them are fairly long. I just want to let you all know that I'll probably cover most of them by the time we get to the end of the webinar. So hang tight. I see a lot of questions that we are going to come to in the future here. Okay, so what about employees with an nth degree of separation is what I'm calling it. We had a call about 2 weeks ago where an employer found out that an employee's roommate was self-isolating because the roommate's boss was self-isolating because the roommate's boss may have come in contact with someone who had COVID-19. And they wanted to know if they could send that employee home. As an employer, you can kind of do whatever you want. If you don't want somebody to work, you can almost always send them home as long as it's for a non-discriminatory reason. In this case, it would be your own fear of them, infecting others in the office. That said, that's a very tenuous, far out there connection that we're talking about. And honestly, most of us in the country have probably been that close to COVID-19 at this point, if not closer. You probably have touched something that has been touched by someone that has been touched by someone who had COVID-19, maybe showed no symptoms, and you don't even know it. So I would just be a little bit careful about sending someone home who's got a connection that's that tenuous. If they can work from home, go for it. Discrimination happens when someone loses a benefit, like you fire them, you reduce their pay, you put them on unpaid leave, you give them, bad hours, change their shift. We don't have discrimination if we don't do anything that hurts them. So if somebody can work from home and make their full income at home, by all means, send them home. If they can't work from home and you're just going to put them out of pay for several weeks, I would worry about them sitting at home contemplating ways to get back at you. So can they come up with a discrimination claim? Can they say they didn't get, 10 lunches that they were entitled to, like lunch breaks, last year, and bring a wage and hour claim once this whole thing blows over? Just try to be reasonable before you put people out of income. It would be my suggestion. That said, if you can send people to work from home, by all means, do send them to work from home. At this point, I think the CDC would like as many people in the country as possible to be going home and staying there. So this is another time or another opportunity to learn something that we might not have known how to do before, and that would be getting some or maybe all of our workforce to work from home. I acknowledge that this is not possible for a lot of employers. You're a restaurant, you manufacture something, you're a landscaping or a construction business. These people can't work from home. I'm sorry that there isn't a better solution. But for those of us who can send people home, let's try it. Let's do it. We should, however, plan to have a policy for that. So if you've never done it before, or maybe you've only done it with a few employees and you hadn't sort of fleshed out a policy, now is a great time to do that. So within your policy, you want to discuss hours of work. You expect them to be online, the exact hours they were generally working in the office, or different hours. Maybe you want them to log in later, or maybe you want them to have a completely different shift, because that would be useful to you right now. We also want to cover expectations regarding reachability. So do you need them to be available by phone? Do you need them to be on some kind of messaging application all day long? Let people know what you need from them and what's expected. Also talk about expectations regarding productivity, and then also set your expectations appropriately. So you're welcome to say in your policy that you want employees to be as productive at home as they are in the office, but there's a decent chance that's not going to happen, particularly if they have children who have been sent home from school or who stay at home all of the time anyway. So, some of us are going to be more productive at home. I'm more productive at home because I'm super easily distracted by noises in the office, and I don't have kids. So I'm great at home. A lot of people are not going to be great at home. As the employer, you should just recognize that you might not get full productivity out of everyone who's gone to work from home. That said, you should still address, what your expectations are. Also cover check-ins. So if you want people to check in with you once a day at the end of the day, or if you want everybody to get together for a video conference at lunch at noon every day to check in, just cover that in your policy. Make sure they understand. And then finally, and this is kind of a big one, you want to cover office expenses. All employers, in my opinion, should cover reasonable and necessary office expenses for employees. You should talk to employees about what reasonable and necessary looks like. So I wrote, really for the purpose of this whole thing, and you can find this on the Support Center. We've got this policy available for you. It's called the Work From Home policy. But what I wrote into that is that employees can spend up to $40 in aggregate on whatever they want to work from home, and they'll be reimbursed for that. We're just going to take their word for it for the first 40 bucks. They still need to submit receipts and all that jazz, but the first 40 is like figured out. But beyond 40, they need manager pre-approval for the expense. So you could set that number wherever you want. You could say pre-approval for everything. You could say pre-approval after $200. You could say pre-approval for singular items that cost more than X dollars. What we don't want to do though is, you know, particularly in like states where they require that employers cover all costs, like California or Illinois, we don't want employees running home, buying themselves an ergonomic chair, a huge monitor, you know, et cetera, and then sending us the bill, and then we have to fight with them about it later and whether it should be covered or not. So lay out some expectations on expenses up front if you're sending people home. And then I want to cover some reminders about pay. I've got non-exempt employee reminders and exempt employee reminders. These are reminders for if you send someone home, particularly midday or midweek. So non-exempt employees need to be paid for all hours worked, even at home. So maybe your non-exempt employees can't do much work at home, but maybe they will be checking in with their manager once in a while, or attending, you know, a 1-hour team meeting once a week by phone just to check in and see when the furlough will be over, whatever it might be. We need to make sure they're getting paid for any time they're working. There's something called the de minimis rule, and that means if an employee is doing so little work that it would be unreasonable to track it or too difficult to track it, then we don't have to pay for it. So this is like you send them a text saying no work today, and they pick up their phone and they read the text. That has taken them literally seconds, or maybe not even a second. That's going to be de minimis. If you've got employees who are, you know, reading lengthy email instructions each morning or twice a week, and that takes them 10 or 15 minutes each time, or even 5 minutes each time, that's time that should be logged and paid for. Also, if you send a non-exempt employee home before their shift is complete, you might owe them reporting time pay, even if you send them home because they're sick. So I want to say there are like 11 states with reporting time pay, and what that is a requirement that if a non-exempt employee comes to work and you send them home before their shift is over, that you have to pay them for a certain portion of that shift, even if they didn't complete it. These rules vary by state. What they generally say is the employee has to be paid for half their shift, but not less than 2 hours and not more than 4. I think that's the rule in a couple of the states at least. There is an exception for, you know, like acts of God in some states, or, you know, things that are outside of the business's control. This could potentially qualify for that. I actually bring this up again later, and I'll read you the list of states where this applies. And we have information about reporting time pay in the support center if you want to check there. Okay, let's talk about exempt employees and what we need to keep in mind for them. So if you send an exempt employee home, these are people who are not entitled to overtime. We can have them work 60 hours a week and we don't have to pay them any extra. They're generally our manager types, our executive types, or our professionals. You can't take a partial day deduction from these folks. So if they come in for 2 hours, then you send everybody home, or they go home sick, we can't take a deduction from their wages for that day, okay? They're still entitled to their full daily wages. You can fill it in with paid time off if they have paid time off available. If they don't have paid time off available, you just pay them. Also, if they do any work during a work week, including any work at home, they're entitled to their full weekly salary. So if you try to send exempt employees home for a full week and say, hey, we're going to be furloughed, but then you send them emails that they respond to, or you ask them questions, or you ask them to get on a client call, they will be entitled to pay for the entire work week because you had them do that work. There are a couple of exceptions to the full work week pay rule. One is if an employee takes a full day off for personal reasons. Personal reasons is not really anything related to COVID-19. It's things like they needed to see their tax accountant or they wanted to take their kid on a school field trip. So that exception is really probably not going to apply here. Unless, of course, you've got an employee who says, I really want to stay home today because I am fearful. And there's nothing else going on. That's just, that could be considered a personal reason. So if they take the entire day off and do no work from home, you could take a deduction. There's also an exception if they take a full day off and they're actually sick and they do no work and you offer what's called a bona fide sick leave plan. A bona fide sick leave plan requires 5 paid days off. So if you don't offer at least 5 paid days during the year that can be used for sickness, you don't have a bona fide leave plan. And if an exempt employee misses even a full day for sickness, you still have to pay them. So basically, if you've got exempt employees, it's a really good idea to combine that with a bona fide sick leave plan. Otherwise, you're going to end up paying for a lot of potential sick time. All right, and sick time is a good segue to our next section, which is on the Families First Coronavirus Response Act, or the FFCRA, as I think we will all get really used to saying. It was passed and signed, and the effective date is April 2nd. There's a lot of stuff going on in that bill, even though it was very short and very quickly written. The sections that are important for employers, or most important for us today, I would say, are the FMLA expansion and the paid sick leave. So we're going to talk about that. Here's the FMLA expansion. So who does it cover? It applies to all employers with fewer than 500 employees, even those under 50. So regular traditional FMLA applied at 50 and above. This is different. This is everybody under 500. Why employers over 500 are exempt? I could list a couple of reasons, but it's still a little bit mysterious to me. So I think probably most people listening are under 500. This applies to you. Employees who are healthcare providers or emergency responders probably don't need to be provided with this leave. We're waiting for clarification on who that applies to. My guess is it will be healthcare providers who are needed under our current circumstances, not necessarily healthcare providers who work at dentist's office or plastic surgery offices. I'm guessing they will not be exempt from this, but we don't know yet. So I can't emphasize enough, this was just passed. The regulatory agencies like HHS and DOL, they've got about 2 weeks to write all the rules and all the explanations that employers need for how this is actually going to work. I'm giving you everything we know on these slides right now. And we are updating our information in the support center constantly. So if things change, we'll update it there. But a lot of this, and I see a lot of the questions coming in, are about this. And we just don't know yet. We're waiting for the government to fill in the blanks and to write the rules and the codes that tell us how to work this thing. So it does say on there that the Secretary of Labor may issue regulations to exempt certain employers with fewer than 50 employees if it would jeopardize basically their whole business to provide this coverage. And several of you have already asked, how do we find out if we're exempt? I assume there will be some kind of application process, but we don't know yet. So hang tight, we'll hear about that later. The only thing that it actually adds, though, the FMLA expansion part, is care for a child under 18 if their school or their daycare is closed. So this is not an FMLA expansion for everything under the sun. It's really just for caring for a child who's been, basically sent home from school for, 2 weeks or 4 weeks or 6 weeks. And here are the pay provisions. So there's no pay for the first 10 days of leave under this type of FMLA. So the stay home with your kid leave is unpaid for the first 10 days. but an employee can use other leave they have if they want to, including this new emergency sick leave that we're going to talk about on the next slide. After those first 10 days, they'll be paid at 2/3 their regular rate of pay. That comes from you, the employer. You're going to pay that money to them for the number of hours they would normally be scheduled to work, but only up to $200 a day or $10,000 total. You're going to get this money back as a payroll tax credit. So I don't have a slide on this because I didn't want people to get attached to the words, because I think we're going to get a lot of guidance on this, hopefully within a week. But what we do know is that it's going to be a tax credit against an employer's Social Security tax bill each quarter. So when your Social Security tax bill comes for your, that you have to pay on all your employees, however much you paid out toward this FMLA stuff or the emergency paid sick leave that we're going to talk about next, that just comes right off the top of your tax bill. So all the way down to zero. If it covers your whole tax bill, fantastic. You don't owe any Social Security taxes that quarter. And apparently you'll get some kind of refund. That's also completely hazy. I have no idea how that works. We'll find out soon. Either the government will cut you a check or they'll take it off your next Social Security tax bill. Don't know how it'll work. But you will get your money back, dollar for dollar, okay? So this is paid for by the government. We're just asking businesses to basically advance the funds. I have also read that they will be trying to figure out if they can, in fact, advance funds to employers if the employer can't fund this themselves. So it's like two things going on here. They say there might be an exemption if you're under 50 and it would jeopardize your business, or possibly we could give you the money in advance and so you can pay it out that way. So a couple things potentially going on there. Hang tight. We're going to know more within a week. Job restoration is required. So, if somebody goes on this FMLA school kid care leave, we can't just fire them and say, don't come back. We need to give them their job back under the law. This is the whole point of FMLA is really job protection, since, regular FMLA doesn't even pay. So we need to give them their job back. There may be an exception if you're under 25 employees and their job doesn't exist anymore because of this public health emergency, and you've made a reasonable effort to find them an equivalent position, and you basically promise to call them within a year if something does open up. So that's one exception we've got going in the law. All right, let's talk about the emergency paid sick leave part. So coverage here is, once again, all private employers with fewer than 500 employees. And it's for all employees, no matter how long they have been employed with you. So if you just hired them last week, they are eligible for this emergency paid sick leave. We've got the same exception for healthcare providers and emergency responders. We need a definition from the Department of Labor on what that means exactly. So hang tight. And then once again, the Secretary of Labor might issue regulations that exempt employers under 50 if it would jeopardize their whole business, or possibly the Treasury Secretary is going to figure out how to advance funds to small businesses. What can emergency paid sick leave be used for? Number one, and this is throwing a lot of people off. So it's if an employee is subject to a federal, state, or local quarantine or isolation order. I don't believe this means when your business closes because your governor or your mayor told the city to shut down. It's possible that they will say that is a local isolation order, but I don't think so. I'm pretty sure that the intent of number one is if a singular person has been told by like the CDC or the state health authority that they need to quarantine or isolate. It's not about overall business closure. Number two, they can use this if they've been told by a healthcare provider that they should self-quarantine. This can also be used if someone's seeking diagnosis for symptoms related to COVID-19. It can also be used to care for someone who qualifies under number 1 or number 2. It can be used to care for a child if their school or place of care is closed. So that's where we fill in that 10 unpaid days of FMLA. The employee can choose to fill in with this time or this pay first. They can also choose to fill in that FMLA gap with leave that you provide otherwise that they might have accrued. And then if they're experiencing other substantially similar conditions, once again, we have no idea what that means. We're going to have to wait for definitions on that one. I don't know what that suggests, what that implies. Those latter uses, 4, 5, and 6, the employee will only be entitled to 2/3 of their regular pay. So full pay if they're caring for themselves, 2/3 pay if they're caring for someone else, basically. Full-time employees will get 80 hours. Part-time employees will get the number of hours worked on average over a 2-week period. So if they're an exactly half-time employee, they usually do 20 hours a week, they're going to get 40 hours. Caps on this are $511 a day, or $5,110 total for those uses for yourself, and $200 a day or $2,000 total for uses when you're taking care of someone else. So once again, this takes effect on April 2nd, and it does not appear to be retroactive at all. So if an employee has already been taking paid or unpaid leave, that's not going to change. Whatever's going on currently will continue to go on. Maybe they're on unpaid leave. On April 2nd, they can come to you and say, all right, I would like to use my emergency paid sick leave now, assuming 1, 2, 3, 4, 5, or 6 actually applies. And again, we're unclear on whether 1 applies to cities closing down. I think it probably doesn't. If your city has closed down and your business has closed down under, because you're required to by the government, your employees are eligible for unemployment insurance. They're also eligible for unemployment insurance if they just have way fewer hours, or not even way fewer necessarily. So they should really be getting on the unemployment insurance train if they are out of work due to business slowdown or, the city closing its doors, or the state basically telling everyone to go home and stay there for the foreseeable future. All right, my last section is on reducing hours or closing. I know this is what a lot of employers are facing right now, so I wanted to address some of the questions we're getting about this. Okay, so some of this is a little bit redundant. We've covered it already, but you can reduce hours or you can reduce pay for non-exempt employees. They only need to be paid for hours worked, unless, of course, you send them home midday, in which case you might owe reporting time pay. You're totally within your rights as an employer to say, starting today, you're a 30-hour-a-week employee instead of a 40-hour-a-week employee. Just because you hired them with a certain expectation doesn't mean you can't change that expectation. If we reduce their hourly wage, though, make sure we're telling them right when we're doing it and that we're not doing it retroactively. So let me explain both of those. Basically, when you hire somebody, you've got an agreement with them that they'll work for X dollars per hour, right? So if you want to change that deal, they need the opportunity to say, I don't like the new deal, I'm going to quit working. So if you change their pay from $20 an hour to $15 an hour, you need to tell them. That can't be a surprise later. Otherwise, we could have sort of various legal claims, breach of contract, wage and hour claims, etc. So just make sure if you're going to reduce somebody's hourly wage that you tell them before you do it, all right? Even if it's like the day of, although I'd certainly prefer more advance notice than that. And you may want to check state law. You also don't want to make it retroactive if you're mid-pay period. So, for instance, if you give notice that their pay is going to change on the 10th of next month, and your payroll period runs from the 1st through the 15th, you need to make sure that for days 1 through 9 in that payroll period, they're making their usual rate of pay, and that you don't change it until the 10th. We don't want to make it retroactive through the whole pay period. Oh, let me go back for a second, because I said I would give you the list of states with reporting time pay. So I'm pretty sure the complete list is California, Connecticut, DC, Hawaii, Massachusetts, New Hampshire, New Jersey, New York, Oregon, although Oregon is only for minors, and Rhode Island. So if you're in one of those states, go ahead and check on the support center to see what the exact law is. Okay, what about exempt employees? We're getting asked this question a lot right now. You can implement a pay cut. You can do it across the board. You can do it for certain types of employees or certain job groups. Do check for unintentional discrimination though. So for instance, let's say you have an all-male sales team and an all-female admin team. I know that's you know, very traditional sounding, but it's still not totally unheard of. If you decide that the admins will take a 40% pay cut while the sales guys will make their, you know, continue to make their full salary, that could look discriminatory. In fact, it probably would be discriminatory. That said, if the sales guys are still doing 100 or even 150% of their usual work, maybe because you sell something in this time of crisis that people need, like hand sanitizer, I don't know, and the admins are doing less work, then, you know, you've got a reasonable explanation for that difference, and I would go ahead and document that. A lot of employers will probably just do an across-the-board pay cut right now to avoid layoff, but not necessarily all of them. Your exempt employees do need to remain above the federal minimum salary, though, for exempt employees, which is $684 a week right now as of January 1st. Or they need to stay above the higher state minimum if you've got one of those. So California's minimum is between $960 and $1,040 per week, depending on the size of your business. New York's minimum is $885 to $1,125 a week, depending on your location. So those are the two states that are like way out there with significantly higher minimums. A couple other states are just a skosh over the federal, but definitely keep in mind that you need to keep exempt employees above that minimum. You can reclassify exempt employees as non-exempt. So if you've got them doing so little work right now under the circumstances, like maybe half of the work they usually do, and keeping them above the minimum salary, either the federal or the state, whichever applies to you, if keeping them above that minimum, given the number of hours they're working, doesn't make sense, you can reclassify them as non-exempt. You don't want to do this on a really short-term basis, though, and you can't like flip-flop back and forth between the two. It's really important that you're not doing this just to evade the salary basis requirements under the FLSA. So, for instance, if you've got exempt employees who, you know, 1 week you want them to be exempt because they're doing a lot of work, the next week, you know, they do hardly any work at all, and you say, okay, well, this week we're going to make you non-exempt, then back to exempt, then non-exempt. That doesn't work. Right now, though, I think what employers are facing is the possibility that business is going to be slow for a while, like, you know, 2 months to 6 months, who knows how long. So these would be an indefinite changes in most cases. I certainly wouldn't suggest doing it for less than a month. So if you want to reclassify an exempt employee as a non-exempt employee, I would say make sure you're doing it for at least 4 weeks. That's not a hard and fast rule that's anywhere out there. The government doesn't actually address this directly, but I think that that's a fairly common sense approach to that. All right, somebody chatted in asking the difference between these terms, and I've got a slide because you are not the first person to ask. A furlough generally means a temporary reduction in hours of work or weeks of work. So to be clear, these don't have perfect legal definitions that like the federal government has issued that everyone understands. So these aren't sort of legal terms of art, but a lot of employers do want to sort of understand the options and use language that people understand. So these are the terms and their general meaning. A temporary reduction in hours of work or weeks of work. So if you've got somebody, if you've got everybody going from 40 hours to 20 hours a week, that could be called a furlough. Or it could be, hey, everybody, we're going to close for the next 6 weeks because the governor told us to. You're all still employees here. You've got a job 6 weeks from now, but we're closing at the moment. See you later in the near future. That's a furlough. That person, stays on the payroll. They're still an employee. We're just taking a little time off. That person can still get unemployment insurance. You don't have to lay somebody all the way off for them to get unemployment. If they're working less or they're working not at all, it doesn't require that they were terminated. And unemployment insurance departments understand this right now. They're dealing with it nonstop. It's not important that you use, the right magical words for them to get unemployment insurance. You should also realize that employees don't necessarily know what these terms mean either. So when you're communicating with them, don't just say, this is a 2-week furlough. Tell them, we're closing for 2 weeks because business is really slow or because the governor told us to. You do have a job with us. This is just temporary, etc. Make sure you explain your intent to employees. Don't just rely on these phrases and hope that they'll understand. A temporary layoff is generally a full layoff. We've taken them off the payroll. We've probably paid out any vacation they were owed or anything else we owed them under our policies or under state law, although we do intend to rehire them probably within 6 months. And then, of course, there's a permanent layoff where we say, we let somebody go and we say we have absolutely no idea if we'll even reopen as a business. So, go forth into the world and do what you can. Okay, so I covered this a little bit in terms of communicating. We do want to communicate in writing, and we want to explain our intent to employees. Don't just use the word furlough. Tell them what it is you're planning to do and what you're thinking about. If you're going to let them use paid leave that they have available with you, like they've got a PTO bank, a vacation bank, personal days saved up, if they're allowed to use that, by all means, communicate that. Also, if you've got a sick leave bank, you could let them use that as well in pretty much all scenarios, particularly if that's a policy that you as an employer have offered as opposed to something that you just offer because it's mandated by the state. Something to think about before you let everybody go home is make sure you've got current contact info for them. If you're used to just, communicating with employees via email or text, you might not have the other way to get a hold of them. So make sure you have current personal contact information for employees so you can, keep in touch with them during your furlough and let them know when they should come back. We had some questions about health benefits. That was a very astute question to ask because this could get weird. So during a furlough, it's possible that a reduction in hours could cause a loss of benefits eligibility depending on what your plan says. So you need to check your plan, talk to your broker, whoever is knowledgeable about your plan provisions to figure out what's going to happen if employees, have their hours reduced. Your plan might say that nobody can have health insurance if they aren't working at least 20 hours a week or something like that. So we want to make sure we're checking plan provisions. If employees do lose coverage during the furlough, they will have other options available almost certainly, like federal COBRA. That applies to employers with more than 20 employees. And then almost every single state has something called mini COBRA that generally fills in the gap between like 2 and 20 employees. Those people will still have access to something called mini COBRA. So figure that out with your benefits provider what is going to be available to your employees so you can articulate that and let them know what their options will be. I said this before, but if you're closing down because business is slow or your employees just don't have nearly as many hours before, they are going to qualify for unemployment insurance almost certainly. So please send them to the state to figure that out. Of course, every state has an employment department or an unemployment insurance department. That varies what they call themselves, but that's where employees need to be going for the math and for the explanation of how to apply. They are all scrambling to make this time easier on people. They're removing waiting weeks. They're waiving work search requirements. I imagine they're, hiring more staff right now. They're sending things online. We, just because of how overloaded we are, we really can't answer questions specific to state unemployment insurance benefits and provisions right now. So we are directing people to go to the state directly. They have a lot more staff than we do, and they deal with this exclusively. So if you're looking for that information, definitely look for the state. If you can't make payroll, this is maybe the most tragic question we're getting asked right now. If you can't make payroll or you don't think you'll be able to make payroll at some point in the near future, you really want to talk to an attorney. You're going to have various kinds of liability, and the best way to go about dealing with that liability will be guided by both the federal laws that apply as well as state wage and hour laws that apply, as well as defenses that might apply, and all of that will need to be addressed with someone who practices in your state specifically and can speak to those things. In contrast, my last slide is a glimmer of hope. The Small Business Administration has said they're going to work with state governors to provide low interest loans to small businesses who are impacted by this whole pandemic coronavirus thing. Loans up to $2 million to sort of help you stay afloat, to make payroll, and to survive all of this. So I would strongly encourage you, that link won't work on your screen, I don't think, but go to sba.gov/disaster. Go ahead and open that in a tab on your screen right now if you'd like to. And we are sending these slides out afterward. So I know this is a lot to take in the space of an hour, but we will send this out. So if you're not in a position to write that down right now, you'll get a copy of that shortly. I want to just pick off a couple of questions before we wrap up here, since we have a couple of minutes. I have 400 questions in the queue, and obviously we've got about 90 seconds. So let me just grab a couple of them. Somebody said, in order for employees to file unemployment, is it correct to assume that they can't be paid for any hours at all? No, that's definitely not true. So as far as I know, most states will allow you to collect unemployment insurance, even if your hours have just been reduced. They probably do need to be reduced somewhat significantly, but that's going to vary by state. But like, for instance, if you've got people who usually do 40 hours a week and you've reduced them to 10, they'll almost certainly qualify for some unemployment insurance. So definitely encourage them to check that out. All right. Somebody says we have an unlimited, actually, I saw a couple questions about unlimited PTO. So we have an unlimited PTO policy, but accrue sick leave. I'm guessing you're in a state that requires sick leave, and that's why you've separated those two, because we'd probably give you that advice. Are employees eligible to use PTO when they don't have any sick leave banked? It really depends on what your policy says. If your unlimited paid time off policy says it can't be used for sick leave, which would be weird, but it could say that, I suppose, then you can say no. You can tell them if they're out of sick leave, they can't use their unlimited PTO. I do think at this point in time, unlimited PTO, we offer that actually. I have access to that, but we call it flexible PTO because we decided unlimited was a little bit of a crazy word. So you could still probably, under the circumstances, put some guardrails around that and say, you know, employees should use up their sick leave, and then they'll be able to use 2 weeks of paid time off if they're out related to, you know, COVID-19. You can make that policy say whatever you want, but definitely look at the language in your policy currently before you make any decisions. And hopefully your current policy, when read carefully, will explain what's going to be the best approach there. All right, thank you all so much. I'm going to pass it back over now.
Thank you so much, Kara. Thank you, everybody. Again, with the questions, 400 questions, probably another 400 coming in through the chat. So we appreciate your questions. Our hope is that through the content, we were able to address most of those. If your questions went unanswered, feel free to email support@gusto.com or just to call in to Gusto support. Gusto also has some other options available to get you more support in this area on a more individual basis with Gusto Concierge. I am going to access, or I'm going to activate a poll as everybody logs out. I know we are at time. If you could indicate here, the reason for this poll is we just want to know how best to follow up with you, how best to communicate with you. This is multi-select, at least I set it to be that way. So if you want both 1 and 2, that's fine. But if you could just let us know if you'd like a demo of the concierge solutions to get access to HR professionals for your unique situation, if you'd like more COVID-19 resources, or nothing today, that's fine as well. I'm going to leave this poll open for the next minute as people file out. I want to thank everybody again for spending a part of your day with us here at Gusto. Kara, thank you so much for both your presentation and the countless hours you have spent keeping up to date on what's going on. We certainly hope everybody has a fantastic rest of your day and a great weekend. Thank you for joining us today.